This is my multimedia project on psychosis in older adults. So to start out, an overview of psychosis. Psychosis is a collection of symptoms. It's a severe condition that affects the mind where the patient loses contact with reality and they have trouble telling the real world from a fantasy. Underlying biological issues with psychosis, the two are brain chemical imbalances and genetic mutations. For brain chemical imbalances, studies have been done that link psychosis to the increased activity of neurotransmitters in the brain, specifically an increase in dopamine, the neurotransmitter. And since dopamine helps send information in the brain, it could be due to an overactivity of information being sent that causes the symptoms of psychosis. We know that the increase of dopamine is a cause because the medications that reduce the effects of psychosis are medications that reduce dopamine in the brain. And then secondly, genetic mutations. Chromosomal abnormalities increase the risk for psychotic disorders. Correlations between having episodes is linked in immediate families. And there are reports of variation in some genes increased susceptibility to psychosis. Next is underlying psychological issues with psychosis. So, having pre-existing conditions or mental illnesses can trigger psychotic episodes. Those pre-existing conditions could be schizophrenia, bipolar disorder, stress and/or anxiety, and depression. Schizophrenia is a mental health condition that causes hallucinations and delusions. It is also the mental health condition that is most commonly linked with psychosis because its symptoms are similar. Bipolar disorder, since it has low mood episodes mixed with high mood episodes or mania, it can often trigger a psychotic episode. Stress and anxiety, severe forms of this cause intense feelings, and those intense feelings could trigger a psychotic episode. And depression, persistent sadness can bring on a state of psychosis as well. The underlying cognitive issues with psychosis. First is attention difficulties. If someone is hearing voices in their head, they're having hallucinations where there's the voices, they're seeing things, that can make it really hard to focus. Lower processing speed is also a symptom here with cognitive issues because if there are voices in your head and you're having those hallucinations or delusions, it can make it harder for your brain to work if it's trying to also focus on the hallucinations going on in your brain. Same with worsened memory, especially working memory. So trying to cognitively remember things that someone is saying to you while they're speaking to you can be very difficult if there's other things going on in your head. And then difficulty understanding social cues. If you're caught up in your own head, it can be hard to perceive the people around you and read their social cues. These all cause cognitive impairment, and if it's hard to read emotions and facial cues, it can be hard to maintain relationships, work, and live independently. Also hard to work if you have attention difficulties or lower processing speed. And brain abnormalities can also contribute to these struggles. Characteristics of psychosis include unusual thinking, which is trouble thinking clearly or being illogical, distorted perceptions, not seeing reality or seeing what's in front of you, but instead seeing hallucinations or delusions, loss of contact with reality, you can't tell your delusions from reality, delusions and false beliefs. You could have beliefs that people hate you or that people are talking about you, but it's all going on in the head, and hallucinations. Specifically here, the types of delusions, delusion of persecution, so that would be like thinking that the FBI is out to get you. Delusion of reference, people on the bus are talking about me, they're making fun of me. Delusions of being controlled is thoughts or impulses are controlled by an external force, that could be like the devil. And delusion of grandeur, where someone believes that they are God or Jesus. And then as well here we have behavioral warning signs, which is suspiciousness, social withdrawal, intense feelings or lack thereof, disrupted sleep, confusion of reality versus fantasy, and decline in performance in job or self-care. Characteristics and clinical features. This will focus on the types of hallucinations. So hallucinations can be auditory, tactile, somatic, or even visual, gustatory, or olfactory. Auditory hallucinations are hearing voices, and it's the most common type of hallucinations. Tactile are things you feel, so burning skin or tingling. Somatic is like a crawling in your stomach. Visual hallucinations are seeing things that aren't there. Gustatory hallucinations are tasting things that are not there, and olfactory hallucinations are sensing odors that are not present. And then command hallucinations are voices that instruct you to do something, and this can be dangerous because someone could say that they're hearing a voice that's telling them to harm themselves, which is, very dangerous. Potential etiology of psychosis. So the causes of psychosis could be genetic risk if you have family members with the disorder, brain development differences. The brain regions involved in social cognition, such as the superior temporal sulcus, could be underdeveloped or have abnormalities. Exposure to stress or trauma can also cause psychosis. Sleep deprivation, it's one that I didn't think of, can cause psychosis. Interfering with brain processes and sensory info, because sleep is essential for function of neurotransmitters. Some prescription medicines can cause psychosis, whether it's the direct side effects of the medication or withdrawals after stopping use of the medication. And then misusing drugs or alcohol. Overusing drugs or alcohol can cause psychosis because alcohol and some drugs are depressants, which block reuptake of neurotransmitters, or if they're depressants, depress brain activity. And then also withdrawals from drugs or alcohol. Prevalence and incidence. Based on the number of psychotic experiences, prevalence differs across lifetime. Adulthood prevalence is 5 to 7%. Children, it's 17%, and in adolescents, it's 8%, with lifetime prevalence being 3.06%. And then of that lifetime prevalence, 0.42% is substance-induced psychosis, and annual prevalence is between 0.015 and 0.1%. And 3% of all people will experience a psychotic episode at some point in their life. So what things can increase your odds of psychosis? Being male, psychosis often starts in younger people, so being young, living in an urban setting, living at higher altitude, or having socioeconomic deprivation or inequality. Treatment with medicines, this is called pharmacotherapy, typically with antipsychotic medications such as the options listed. With all medications, it's important to find one that works for you on a patient-by-patient basis because you want to have the least side effects. And all antipsychotic medications work because they decrease the activity of neurotransmitters, typically dopamine in the brain, which cause symptoms of psychosis. Another form of treatment is with talk therapy. Coordinated specialty care, individual psychotherapy, group psychotherapy, and family education programs are types of therapy as well. Additional things that can help to set someone with living with psychosis up for success are supported employment services or options. So being employed through a program that either helps out with understanding the hours that someone with psychosis can work, or in the event that they couldn't work, and having special services for them in the workforce, as well as supported education services, so same idea but on an education basis. And then case management, working with either a therapist or a human resources manager to understand their condition and get them the things they need to succeed, whether that be employment, education, medication, or therapy. Involving the patient in planning their treatment is very important so that they know what they're doing. Treatment is set up for success, supported employment services, supported education services, managing their case by case, involving the patient in their treatment and planning, and then having support from your family. And then here are all my references.